Tonight, before you pull back those covers and close your eyes, I need 60 seconds of your attention. Not because I want to frighten you, not because I want to sell you something, but because after 35 years of sitting across from patients over the age of 60, reading their charts, reviewing their overnight monitors, and yes, sometimes delivering the hardest news a doctor ever has to deliver, I have identified 5 specific nighttime habits that are quietly working against your heart and your brain while you sleep. And here is what makes this conversation so important. Most of the people I am going to describe tonight were not in poor health. They were not ignoring their bodies. They were doing what they thought was the right thing. They just didn't know what I am about to tell you. My name is Dr. Leonard Brooks. I am a board-certified geriatric physician with 35 years of clinical experience treating adults over 60. I have published research on cardiovascular aging. I have trained residents in geriatric medicine, and I have spent the better part of 4 decades trying to answer one question. Why do so many otherwise healthy older adults experience heart attacks and strokes in the overnight hours? The answers, it turns out, are hiding in plain sight, in the routines we follow every single evening without a second thought. By the time this video ends, I am going to give you a clear, evidence-based nighttime routine, one that costs nothing, takes less than 30 minutes, and is built on what we actually know from peer-reviewed cardiovascular and sleep research. Let's start with what most people fundamentally misunderstand about sleep itself. Why nighttime matters so much after 60. Sleep is not a passive state. Your body does not simply power down when you lie down. What actually happens is a remarkable coordinated process. Your blood pressure is supposed to drop, a phenomenon physicians call nocturnal dipping, and this drop is critically protective. Your heart rate slows. Your brain initiates a waste-clearing process through what researchers call the glymphatic system. Growth hormone is released. Cellular repair accelerates. When this system works as designed, a full night of sleep is the single most powerful cardiovascular recovery tool your body has access to. But here is what changes after age 60. The architecture of sleep shifts. Deep, restorative sleep stages become shorter. The body's ability to regulate temperature, blood pressure, and heart rhythm becomes less precise. Blood vessels that have spent decades under pressure are stiffer and less forgiving of sudden spikes. The margin for disruption narrows. This is why the same habits that a 40-year-old might handle without consequence can become genuinely dangerous in someone who is 65 or 70. It is not that the body is broken. It is that the buffer zone is smaller. And certain nighttime habits consistently chip away at that buffer in ways most people never see coming. Let me walk you through each one. We are going from 5 to 1, and I want you to pay close attention as we get deeper into the list, because the risks escalate significantly. Habit 5. Eating a heavy meal close to bedtime. Let's begin with something you may have heard before, but probably not explained this way. When you eat a large meal, particularly one high in fat, refined carbohydrates, or sodium, your digestive system immediately demands significantly increased blood flow. Your stomach, intestines, liver, and pancreas all require additional circulation to process what you have consumed. To meet that demand, your heart pumps harder and your blood pressure rises. The problem is that this is happening at the exact time your cardiovascular system is biologically programmed to do the opposite. Research published in the European Heart Journal has established that late-night eating is associated with elevated nighttime blood pressure and disrupted cardiac rhythm, particularly in older adults. A separate body of research on something called postprandial hemodynamics, meaning how blood moves through the body after eating, confirms that large meals can temporarily impair blood flow regulation in ways that are more pronounced in aging cardiovascular systems. There is also a secondary issue that rarely gets discussed. Late eating significantly worsens gastroesophageal reflux in older adults, and nighttime acid reflux is not merely uncomfortable. Stomach acid that reaches the esophagus can stimulate the vagus nerve, a major nerve that directly influences heart rate. In susceptible individuals, and particularly in those with pre-existing arrhythmias, vagal stimulation during sleep can trigger irregular heart rhythms. The practical guidance here is well supported. Aim to finish your last meal at least 2 to 3 hours before bedtime. Keep evening meals lighter, lean proteins, vegetables, moderate portions. Your digestive system and your heart do not have to compete if you give them enough time to work in sequence rather than simultaneously. Habit 4. Going to bed even mildly dehydrated. This one surprises nearly everyone I discuss it with in clinical practice, and it is more common than most people realize. After the age of 60, the body's thirst sensation becomes measurably less reliable. Research from the National Institutes of Health and multiple aging physiology studies has confirmed that older adults frequently reach a state of clinical dehydration without experiencing noticeable thirst. This is not a personal failing. It is a physiological change in how the hypothalamus processes thirst signals as we age. The consequence of even mild dehydration at night is something called hemoconcentration. Essentially, your blood becomes thicker and more viscous. Thicker blood moves more slowly through your blood vessels, and slow-moving blood is significantly more prone to clotting. Now combine that with the natural overnight slowdown in circulation. Your heart rate drops, your blood pressure decreases, and you have created conditions that are genuinely unfavorable for cardiovascular health. This is particularly relevant in anyone who already has risk factors for stroke or heart attack, such as atrial fibrillation, arterial plaque, or compromised circulation. A study published in the journal Nutrition found that hydration status was independently associated with cardiovascular markers in older adults, even after controlling for other risk factors. Many of my older patients tell me they deliberately stop drinking water in the late afternoon because they want to sleep through the night without bathroom trips. I understand that completely. But here is the clinical reality. The risk of a compromised blood chemistry overnight is significantly greater than the inconvenience of one nighttime bathroom visit. The practical approach is this. Drink a moderate glass of water, 6 to 8 ounces, 1 to 2 hours before bed. Use the bathroom immediately before lying down. Keep a small glass of water on your nightstand. These 3 simple adjustments maintain overnight hydration without meaningfully disrupting sleep continuity. Habit 3. Unrecognized or untreated sleep apnea. We are now into the top 3, and I want to be direct with you about this one because it is both extremely common and extremely underrecognized. Obstructive sleep apnea is a condition in which the soft tissue at the back of the throat collapses repeatedly during sleep, partially or completely blocking the airway. When this happens, breathing pauses. These pauses, called apneas, can last anywhere from 10 seconds to over a minute. In moderate to severe cases, they can occur dozens or even hundreds of times per night. Each apnea triggers a cascade of physiological stress responses. Oxygen levels in the blood drop. The brain, sensing danger, activates an emergency arousal. You partially wake up, breathing resumes. Oxygen returns. This happens so quickly that most people have no conscious memory of it in the morning. They simply feel unrest, groggy, and often assume they are just not a good sleeper. But what is happening beneath that surface is serious. Every apnea-related oxygen drop and arousal causes a surge in sympathetic nervous system activity, your fight or flight system. Blood pressure spikes repeatedly through the night. The heart is subjected to repeated episodes of oxygen deprivation and abrupt pressure changes. Over time, this strains the cardiac muscle, contributes to hypertension that is difficult to control with medication, and significantly elevates the risk of atrial fibrillation, an irregular heart rhythm that is itself a major risk factor for stroke. Research from the American Academy of Sleep Medicine and data published in the Journal of the American Medical Association both confirm that untreated obstructive sleep apnea substantially increases the risk of heart attack, stroke, and cardiovascular mortality. The connection is not subtle. It is one of the most well-established relationships in sleep medicine. And critically, research consistently shows that a large proportion of moderate to severe sleep apnea cases in adults over 60 remain undiagnosed. The warning signs to be aware of include loud, chronic snoring, particularly snoring with gasping or choking sounds, waking up feeling unrefreshed regardless of how many hours you slept, morning headaches, and blood pressure that remains elevated despite medication. If any of those descriptions sound familiar, please speak with your physician about a sleep study. Modern sleep studies can often be done at home with a simple monitoring device. And treatment, most commonly a CPAP device that delivers gentle airway pressure during sleep, is well tolerated by most patients and can produce dramatic improvements in both sleep quality and cardiovascular risk markers. This is not a minor issue to put off. It is worth a conversation with your doctor at your next appointment, or sooner if the symptoms are significant. Habit 2. Inconsistent medication timing, particularly for blood pressure. I want to speak plainly about this one because it is the most directly controllable risk factor on this list, and it is one I have seen cause genuine harm to patients who were otherwise doing everything right. Blood pressure follows a predictable 24-hour pattern in the human body. It naturally rises in the late morning, dips in the early afternoon, and most importantly, it rises again sharply in the early morning hours, typically between 3 and 7 a.m., as cortisol levels increase and the body prepares to wake up. This is called the morning blood pressure surge. In a well-managed patient whose medication is working consistently, this surge is blunted and controlled. But in someone whose medication has worn off overnight, either because they skipped a dose, took it much earlier than usual, or are on a shorter-acting formulation, the morning surge can become extreme. Blood pressure spikes to dangerous levels at the exact moment the cardiovascular system is making its daily transition from rest to activity. Arterial plaques that are already vulnerable can rupture under this sudden pressure. Blood clots can form rapidly. Heart attacks and hemorrhagic strokes most commonly occur in these exact early morning hours, a pattern that cardiovascular researchers have documented extensively. This is not theoretical. Studies published in The Lancet and the Journal of the American College of Cardiology have confirmed the morning surge phenomenon and its relationship to cardiovascular events. Research from the MAPEC study, a significant randomized clinical trial, found that taking antihypertensive medication at bedtime rather than in the morning was associated with meaningfully better blood pressure control overnight and a reduction in cardiovascular events. I am not suggesting you change when you take your medication without speaking to your doctor. Every patient is different. Every medication has specific timing requirements, and your physician knows your situation. What I am suggesting is that you raise this question in your next appointment. Ask, given the morning surge in blood pressure, would bedtime dosing make sense for me? And regardless of timing, never skip a dose. Never assume that feeling fine means your blood pressure is fine. Hypertension is famously silent until it is not. Set a daily alarm if that is what it takes. Put your medication next to something you use every single evening. Make the habit automatic. This is the single habit on this list where the intervention is clearest, the evidence is strongest, and the results are most directly in your control. Habit 1. Sleeping in a room at the wrong temperature. And now we arrive at the number 1 habit, the one that gets the least attention and that I genuinely believe influences cardiovascular outcomes during sleep more than most people would ever guess. The temperature of your sleeping environment. This is not about comfort. This is about cardiovascular physiology, and understanding the mechanism will change how you set your thermostat tonight. Here is what happens when a room is too warm, above approximately 72 degrees Fahrenheit or 22 degrees Celsius. Your body's core temperature is supposed to drop during sleep. This drop is not incidental. It is a required trigger for the deepest, most restorative stages of sleep. When the room is too warm, your body struggles to release enough heat to achieve that drop. Blood vessels in the skin dilate continuously to push heat outward. Your heart rate remains elevated rather than settling into its natural nighttime rhythm. You sweat, losing fluids and contributing to the dehydration risk we already discussed. Your sleep becomes lighter and more fragmented, robbing your cardiovascular system of the repair time it depends on. And critically, your blood pressure never achieves its natural nocturnal dip. Instead of dropping as it should, it stays elevated through the night, extending the period of cardiovascular strain into the hours that are supposed to be its recovery window. Research published in the journal Sleep Medicine Reviews has examined the relationship between ambient temperature and sleep architecture, confirming that elevated sleeping temperatures suppress slow-wave sleep, the deepest, most restorative stage, and increase nighttime sympathetic nervous system activity. A warm room at night is, in physiological terms, a mild but sustained stressor on your cardiovascular system. Now here is what most people do not expect. Cold is also a problem. Room temperatures below approximately 60 degrees Fahrenheit or 15 degrees Celsius cause a different but equally significant response. Blood vessels constrict sharply to conserve body heat. This vasoconstriction increases the resistance your heart must pump against, raising blood pressure. In arteries that are already stiffened by decades of wear, This sudden increase in resistance is not trivial. It raises the risk of plaque rupture and is one of the reasons cardiovascular events are statistically more common during cold weather and cold sleeping conditions. The ideal sleeping temperature, the range that allows natural nocturnal blood pressure dipping, supports deep sleep architecture, and minimizes cardiovascular strain, is between 65 and 68 degrees Fahrenheit, or approximately 18 to 20 degrees Celsius. If you do not have precise thermostat control, lightweight breathable bedding, a fan for air circulation, or sleeping with a window slightly open can help approximate this range. The investment in a programmable thermostat is, from a health standpoint, genuinely worth considering. 2 or 3 degrees of difference in your bedroom temperature might seem trivial. Physiologically, for a cardiovascular system that is 65 or 70 years old, it is not. Now I want to give you what I promised at the beginning, a practical, evidence-based evening routine that addresses every one of the habits we have covered. This routine does not require any special equipment, supplements, or significant lifestyle disruption. It requires intention and consistency. Research in behavioral medicine consistently shows that routine-based habit formation is the single most effective way to sustain health behaviors over time. So treat this as a sequence, not a checklist. At 6 to 6:30 in the evening, finish your last meal. Keep it moderate, lean protein, vegetables, whole grains if desired, reasonable portions. Allow your digestive system to complete most of its work before your body begins its transition towards sleep. At 7:30 to 8 p.m., drink a moderate glass of water, 6 to 8 ounces. This is your intentional hydration window. It gives your kidneys time to process excess fluid before you lie down, and it maintains blood viscosity through the overnight hours. At 8 p.m., take your prescribed medications exactly as your physician has directed. If timing has not been specifically discussed with your doctor, bring it up at your next visit, particularly if you are on blood pressure medication. Set a daily phone alarm for this moment so it becomes reflexive. At 9 to 9:30 p.m., begin your wind down. Lower the lights in your home. Step away from emotionally stimulating content on screens, not because screens themselves are dangerous, but because elevated cortisol and emotional arousal in the late evening work directly against the hormonal shift your body needs to transition into restorative sleep. A book, calm conversation, or gentle music are all physiologically preferable to high-stimulus television in this window. At 9:30 p.m., set your bedroom thermostat to 66 degrees Fahrenheit, or as close to that as your setup allows. Place a small glass of water on your nightstand. This is your dehydration safety net if you wake during the night. At 10 p.m., use the bathroom fully before lying down. This reduces the likelihood of a middle-of-the-night waking and allows you to settle in with confidence. If you have been told you snore chronically, or if you wake feeling unrefreshed regardless of sleep duration, position yourself to sleep on your side. Side sleeping significantly reduces airway collapse for most people with mild to moderate sleep apnea. A body pillow or a pillow position behind your back can help you maintain that position through the night. As you settle in, take 5 slow, deliberate breaths. Inhale for 4 counts, exhale for 6. This is not ceremonial. Prolonged exhalation activates the parasympathetic nervous system, your body's rest and digest mode, and begins the physiological shift toward lower heart rate and lower blood pressure. It is a small act with a measurable biological effect. I want to close with something I tell patients directly when they sit across from me in the exam room. Your heart has been working for you, without interruption, for every minute of every day of your life. It has never taken a day off. It has adapted to stress, to illness, to decades of demands you placed on it consciously and unconsciously. It is a remarkable organ.